Thank you. Warm greetings from the Krishna Institute of Medical Sciences, Karad. Sorry for the minor technical glitch a little bit earlier. So today I'm here to present you my case series. Now, as a doctor or a dentist, what matters to most to all of us is obviously the patient's experience. How we make the patient feel on our dental chair inside our clinic does matter the most for anybody's practice. Now, in that sense, the need of the hour is definitely we being adapting to the changing times. We cannot still fight the yesteryear wars with an outdated weapons. So we have to always upgrade ourselves with the latest technology so that we can provide the best to our patients. So why is it necessary to upgrade ourselves? We all know there is a tough competition in every field. Take it, for instance, medical field or a dental field or any other technical field. Now, when we are spoiled with a lot of choices in front of us, what makes us stand out in the crowd? Why should a particular patient opt to get treated under you? So that is one major aspect what we need to work out. So once we know how to stand out from the crowd, definitely we can have a successful practice. So with this background, I'm here, Dr. Siddhartha Varma, to present a topic on photobiomodulation in dentistry, a light that heals. If you go back to the history of lasers, it's been a significant, marvelous journey through the early 1960s to the current era. As we all know, the first laser invented in the 1960s was a ruby laser, which eventually led to invention of several other new lasers. So there are a plethora of lasers available in the current market where we can choose upon to perform our dental procedures. Now, if you see to consider some of the most significant discoveries in dentistry in the recent past, probably implants, lasers definitely stand in the top 5. Now, if you just try to classify the lasers, so one way of classifying them would be based on the spectrum they belong into. It could be the invisible ionizing radiation, or in the visible spectrum, or in the invisible thermal radiation. So based on the wavelengths, what you can see in front of your screen, we have the following different types of lasers available, which can be used for a variety of procedures. Now, with a laser, what all procedures could be performed? So gone are those days when laser was primarily meant only to ablate or cut your tissues. So with more and more advance of science, we can definitely apply the principles of lasers in various aspects. As you can see, right, apart from the laser ablation or soft tissue surgery or a hard tissue surgery, it can also be used for the tooth whitening procedures, the composite curing, the photobiomodulation. At times, with the emission principle, it can be used for fluorescence or the microscopy. It can also be used for photodynamic therapies and several other diagnostic purposes. Now, today I will be rather more focusing on the photobiomodulating effect of the lasers. We all know the use of lasers, the significance of it in surgical procedures. But now, if you try to decode the word photobiomodulation, so it is nothing but it describes the biochemical reactions that occur in living cells in response to the lights. So when I initiate the cells with a light, what influence the light exerts on the cells is nothing but your photobiomodulation. It is previously referred as the low level laser therapy or the cold laser therapy. So in this particular therapy, the light energy is used to elicit biological responses from the cell and normalize the cell function. In medicine and dentistry, lasers used in phototherapy are included in photobiomodulation are the low level lasers or the class 3 lasers. Now, what is essential to remember here is, if I want the photobiomodulating effect or the low level laser effect, the output of power should be maximum up to 500 milliwatts. Beyond this output of 500 milliwatts, the laser will not exert its photobiomodulating effect. Rather, it would exert its heating effect and cause thermal damage to the cells. If you go back to the history, surprisingly, it's not something which has started very recently. It started way back in 1960s by Andre Mester, where he found the effect of PBM in accelerating the healing processes. Similarly, PBM was also used by NASA researchers for enhancing the healing processes in space. Now the golden question, why should I opt for a laser if I can do majority of my procedures with the help of a scalpel, and if I try to upgrade I can use a electrocautery? Well, this is the answer. As you see in front of you, the various depth of tissues which are damaged when I cut with a scalpel would be in the range of 100 to 300 cell layers. Instead of a scalpel, if I use electrocautery unit, the cell layers involved will be in the range of 1000 to 1500 cell layers. The same with performed with a diode laser, I will be limiting to 15 to 25 cell layers. And if I use a water laser, it will be much more lesser to an extent of 5 to 10 cell layers. So we can see the depth of penetration of the cells which are damaged due to my procedure will be very minimal with laser. Now, how is this important? That we'll see in the coming slides. The moment I irradiate my laser onto the tissue, there are 3 to 4 different zones of action taking place there. One is the vaporization, the carbonization, and the coagulation on the superficial areas of the tissue. And slightly deeper inside the tissues, we have the biostimulation effect. So, how would I support laser in comparison to a scalpel? As we all are well aware, the amount of bleeding is pretty much less or almost nil with the help of a laser. It would be more painless and very limited need for anesthesia as compared to a scalpel technique. I get a high precision with a laser. The wound itself can be disinfected by laser while cutting, whereas with a scalpel, it is more susceptible to infections. So faster healing and a small scar formation with a laser as compared to a slow healing in comparison with a scalpel, because of which the pain relief and discomfort will be very less with a laser, and it is simple and time saving. So considering these advantages, laser can always be a value addition tool to our dental practice. Now, how does a laser help you in curtailing the healing process? So as we can see here, when you consider a normal healing cascade, as soon as there is an injury, the first step is your barrier clot formation, followed by inflammatory changes. Then there is tissue regeneration, tissue remodeling, and then a completion of healing. The moment I start using a laser for a wound healing cascade, the first few phases are almost reduced. That's why the entire healing phase or the time required for healing completely gets cut down to more than half. So the barrier clot and inflammation is pretty much under control. So I progress towards the regeneration and remodeling phase pretty much early with the laser. So how exactly this mechanism of action takes place, the photobiomodulatory effect with the laser? As we all know, the powerhouses of the cell are nothing but your mitochondria. So the moment the light photons are initiated onto a tissue surface, these photons are absorbed by the mitochondria of the cell. Inside the mitochondria, the target area is your cytochrome C oxidase and the porphyrins. So once the cytochrome C oxidase absorbs your laser photonic energy, they generate your reactive oxygen species like superoxide anions and hydrogen peroxide, all of which help in stimulating your cell signaling and gene transcription. Similarly, because of absorption of photon energy by the mitochondria, there is removal of nitric oxide of the binding site of cytochrome C oxidase, which eventually increases energy production or increases ATP production. So because of this increased ATP production and increased generation of reactive oxygen species, I see an enhancement in the wound healing, the tissue repair, prevention of tissue death, as well as relief of inflammation, pain, and neurogenic pain and neuro problems. All of this can be taken care with the help of your laser. So these clinical effects are not only from the direct irradiation of the tissue, but also from the secondary and the tertiary effects as well. Certain factors like increase in lymphatic flow and circulation, stimulation of fibroblasts, the osteoblasts, odontoblasts, and the endorphins, reduction of the depolarization of nerve fibers, and the modulation of inflammatory chemicals all contribute to the clinical effects which are seen with photobiomodulation. Now, depending on the wavelength I use, the mechanism of action slightly changes. So just in a couple of slides ago, what we discussed. So when I use a red light in the wavelength range of 600 to 810 nanometer, the target area would be the cytochrome C oxidase of the mitochondria. So the photonic energy is absorbed by cytochrome C oxidase, and it eventually results in increased ATP production, ROS, and helps you in proliferation, migration, and differentiation. The same thing if I use a near infrared light, so a laser in the wavelength of 800 to 1064 nanometer, the site of action would be your calcium channels. So the light sensitive ion channels are activated. So there is increased influx of calcium, which in turn increases cyclic AMP production and reactive oxygen species production. Eventually, whichever wavelength we are using, ultimately it helps you in enhanced proliferation, migration, and differentiation. So this is how the biomodulation of human cells takes place. Now, what is the most important aspect when I'm talking about PBM is obviously the dosage. The tissue dosage is expressed in terms of fluence or energy density, which is measured in joules per square centimeters. The total produced energy is determined by multiplying the output power of the laser in milliwatts by the time of exposure in seconds. So to simplify it, if I'm using a 50 milliwatt power for 40 seconds, I am applying an energy density of 2000 millijoules or 2.0 joules. So if you can see the picture, a simple 650 nanometer wavelength of laser, when irradiated, it can show the penetration of laser light even through the bone. Now what you see in front of us is a neuron picture before the low level laser radiation in the picture A, and once I irradiate the neurons with a laser light, we can see an increase in formation of varicosities all along the axons. So these varicosities are transient but are thought to be the obstacles in neural transmission, all of which will help you in decreased pain perception. So basically, I get the desired effect as long as my dosage is right. So that dosage is determined by Arndt-Schulz law, which says doses between 0.01 and 10 joules per square centimeter are stimulating the wound healing, but higher doses are inhibitory. So as far as the dosage is right, I get a positive result. The moment I increase the dosage, it might definitely show me inhibitory or negative effects. So my targeting the right dosage is pretty much important. Now coming to treating acute versus chronic conditions. So as the general rule, we always apply high doses of laser energy if you're treating an acute condition, especially where there is high inflammation and edema. Whereas a chronic condition will require much lesser doses. Initially, acute conditions can be treated until they resolve and the pain is no longer present. Whereas chronic conditions should be treated 2 to 3 times in a week. Patients with long-standing chronic pain conditions may experience a flare of pain after a dosage of PBM, which is commonly known as a treatment reaction. So this reaction is transient and actually shows that the patient is responding well to your treatment. The underlying mechanism is believed to be involving transformation of the chronic situation into an acute phase, allowing healing to begin. So the pain levels are reduced below the baseline within 24 hours. The patient should be informed about this possibility of flare-up of pain before treatment to avoid a reduction in compliance.
Doctor, still 5 minutes. Please include within 5 minutes.
Yeah, thank you. So based on the conditions what my patient is experiencing, I decide on the dosage of my photobiomodulation. Similarly, if I continuously use it in a week, the cumulative dosage will keep on increasing, which inhibits my effects. So I have to space my dosing in a week so that the cumulative dosage is within the limits and I have a stimulating effect. So what happens to your lymphatic channels and blood vessels on irradiation of laser? We can see an increase in diameter, which helps you in drainage of the lymphatic vessels and increased blood supply to the target site. So we have the usage of photobiomodulation in various orofacial ailments like treating oral mucositis, where specific parameters are already prescribed in the various societies and the journal articles. So it could be an excellent tool for treating oral mucositis as a prophylactic therapy, a radiotherapy, or as a therapeutic option. Excellent results in treating burning mouth syndrome. Excellent result in treating oral mucosal lesions like non-healing ulcers. We can see within 24 hours invagination of the borders, and by the end of 4th day 80% reduction of your ulceration. So excellent tool in managing those lesions. Also a role in lichen planus management. With 8 sessions of PBM, we can reach to this improvement in the condition. Excellent utility in oral surgery as well, where it can be used for enhancing your healing potential. Immediately post extractions, we can definitely use photobiomodulation to elevate the pain and enhance the healing. So this is a picture which shows healing within 24 hours. A patient who was on antiplatelet, he underwent a traumatic extraction followed by photobiomodulation. So we see a good amount of healing after 24 hours. It can be used for draining your lymph nodes when there are serious infections and swelling. It can be used in restorative dentistry, where lasers are effective on the C fibers or the endorphin levels. It can be used for controlling the nausea and gagging effects of your patients, where we identify certain points on the wrist of the patient and we can perform a laser acupuncture, which will help you in elevating the nausea and gagging effects. Also has role in implant placement, in treating peri-implantitis, where I can use lasers for surgical debridement, followed by photodynamic therapy to eliminate the microorganisms, followed by photobiomodulation to enhance the healing. Can be finding its role in orthodontics, which stimulates the osteoblasts and results in an increased velocity of tooth movement, and also decreases the pain caused from pressure on the teeth during orthodontic tooth movement. Well, in periodontology, it has varied applications right from surgical options to photobiomodulation effects. Like a surgical option after crown lengthening, followed by a dosage of photobiomodulation, will accelerate the healing, and we can see in the picture within 48 hours excellent healing of the soft tissues. Similarly, photodynamic therapy in periodontics, where we can use a photosensitizer dye injected into the sulcus, followed by laser irradiation. So the commonly used dyes are indocyanine green and methylene blue. So the moment I irradiate laser light on those dyes, they release reactive oxygen species or singlet oxygen and destroy the pigmented microorganisms. So after every surgical procedure, I can always use lasers in a photobiomodulation mode to enhance the healing. Can be used in endodontics for a root canal disinfection. So conventional disinfectants can only penetrate to an extent of 300 micrometers, whereas studies have shown the microorganisms can penetrate much more deeper. So a laser assisted disinfection can penetrate 1000 micrometers into the dentinal tubules. It can be also used as a diagnostic tool in endodontically involved teeth. So long lasting excellent results are seen with the use of lasers in treating dentinal hypersensitivity as well. So we target specific points along the cervical margins of the tooth and irradiate those points with a laser, which help you in alleviating the hypersensitivity symptoms. Can be used for treating neuropathic pain. Can be an excellent tool in teeth whitening with absolutely or nil post-operative hypersensitivity. Well, the golden question is it safe? Yes. If a cell is damaged or in a reduced redox state, the cellular response will be stronger. Conversely, a cell which is at an optimal redox potential will have a weak or an absent cellular response. Thus, cells that are damaged or sick will respond better to PBM, better than cells that are healthy and functioning normal. Now the million-dollar question, which laser should I invest in if I'm deciding to invest in a laser? Does cytochrome C oxidase absorb all wavelengths of therapeutic window in the same way? The answer is absolutely no. So the research suggests lasers in the wavelength range of 600 to 670 and 780 to 880 are the lasers which show the cytochrome C oxidase is absorbed maximum. So if you are targeting to buy a laser, these are the two wavelengths which you should always opt for in your laser system. Apart from the wavelength, what is the versatility your laser is providing is one more critical question. and what generation of optical delivery kit they are providing is also very important. If these things are taken into consideration, the fastest return on laser investment will always be possible. So only a cutting laser will not give you a faster return on your investment. So if your laser machine has other applications like used in oncology, neurology, endo, perio, and all other things, you get a good, faster returns. Also, the post sales and services are very, very important before deciding on buying the laser system. So finally, to conclude, photobiomodulation is an evolving technology. With every passing day, more is being discovered about the mechanisms of laser therapy, doses, treatment locations, and the diseases in which a laser will have an effect. A tool, it can reduce pain, stimulate wound healing, modulate the inflammatory response, and regenerate nerves. So better managed treatments that are often deemed painful by patients without prescribing pharmaceuticals. So as going by the famous quote by Rumi, the wound is a place where the light enters you. So use the energy of light to heal the wound. So with this, I would like to end my presentation and thank the organizers for giving me this opportunity to present my cases in front of you. Thank you one and all.